Deep cleanse plus gentle extractions plus a daily routine that actually works. No fluff. Clean hands, hair back. Tools wiped with 70% isopropyl. Start on dry skin. We begin our ritual with a gentle, fragrance-free gel cleanser. Choosing a fragrance-free formula is key to preventing any unnecessary irritation before we proceed with our treatment. Emulsify a small amount with lukewarm water and using your fingertips, work in slow, deliberate circles for at least 45 seconds. This duration allows the cleanser to thoroughly dissolve makeup, sebum, and impurities. Always use lukewarm water. It's the perfect balance. Once rinsed, gently pat your skin dry with a fresh, soft towel. Remember to pat, never rub. Rubbing creates friction that can lead to micro tears and irritation. Now, we prepare the skin for extraction. We'll use thin cotton strips soaked in a 0.5 to 1% salicylic acid solution. Salicylic acid, a BHA, is oil-soluble, allowing it to penetrate deep into the pores. This process softens hardened sebum, making extraction significantly easier. Carefully lay these saturated strips over congested areas like the nose and chin. Let them rest for just 30 to 40 seconds. This short contact therapy provides the full benefit of the acid without irritation. Remove the strips. Your pores are now perfectly prepped. Now let's begin the extraction process with the utmost care and gentleness. The first and perhaps most crucial step is preparation. We need to soften the skin and open the pores to allow for an easy, trauma-free release. This isn't about force, it's about finesse. We'll start by preparing a warm compress. Take a clean, soft face towel and immerse it in warm water. The temperature is key here. It should feel pleasantly warm to the touch, like a comforting embrace for your skin, but never hot. Press the damp towel onto the area you'll be working on for a full 60 seconds. Let the gentle heat penetrate the skin. This warmth helps to liquefy the hardened sebum trapped within the pores, making extraction significantly easier and safer. Remember, a short and warm application is always better than a long and hot one. Excessive heat can lead to irritation, sensitivity, and even broken capillaries, which is the opposite of our goal for healthy, clear skin. If you're using an extractor tool, ensure it is thoroughly sterilized with rubbing alcohol before and after every single use. This is non-negotiable for preventing the spread of bacteria. Now place the small loop of the tool so it encircles the blackhead or clogged pore. Instead of pressing straight down, which can bruise the skin or push the impaction deeper, angle the tool at about 30 to 45 degrees. Apply very light pressure and use a gentle rocking or seesaw motion from side to side. This coaxes the blockage out rather than forcing it. If the contents don't release easily, do not persist. Give it one more gentle try, and if it still resists, leave it. The pore is not ready. Forcing it will only cause inflammation and potential scarring. Your skin's health is the priority. Alternatively, you can use your fingers, but only with a protective barrier. Wrap your index fingers with fresh tissue. This ensures your nails don't break the skin and that the process remains hygienic. Place your wrapped fingertips on either side of the pore. Now, gently press down and slightly apart to apply pressure from underneath the pore, then roll your fingers upwards to lift and release the blockage. The motion is down, apart, and up. Listen to your skin. If you feel any sharp pain or see any blood, stop immediately. This is a sign of too much pressure. And crucially, never attempt to extract blemishes that are inflamed, red, painful, or deep under the skin, like cystic acne. This will only worsen the inflammation and can lead to permanent scarring. After any successful extraction, gently wipe the area with a soothing, alcohol-free toner to calm the skin and disinfect the pore. Now let's move into the gentle art of post-extraction care. Your skin is vulnerable, so our first step is to soothe and protect. Immediately after you've finished, apply a whisper-thin layer of a 0.5 to 1% salicylic acid serum. Salicylic acid is a beta-hydroxy acid, or BHA, which means it's oil-soluble. It can penetrate deep into the pore lining to gently clear out any remaining debris and has wonderful anti-inflammatory properties to begin the calming process. Pat it on gently. Never rub the skin after extractions. Think of this as a liquid bandage, creating a clean, healing environment for your skin. If your skin is on the sensitive side and finds salicylic acid too stimulating, we have beautiful alternatives. You can opt for a polyhydroxy acid, or PHA. Think of PHAs as the gentle giants of exfoliants. Their larger molecular size means they work on the surface, providing gentle exfoliation with an added hydrating benefit. Another excellent choice is a 10% azelaic acid formula. It's a true peacemaker for the skin, brilliant at reducing redness and inflammation, while also helping to prevent post-inflammatory hyperpigmentation, those stubborn dark spots that can linger after a blemish has healed. If you're seeing a particularly inflamed, angry bump, it's time for some cryotherapy. Wrap an ice cube in a soft, thin cloth. Never apply ice directly to the skin. Press it gently against the inflamed area for 60 seconds, then remove it for 60 seconds. Repeat this cycle 3 times. The gentle cold encourages vasoconstriction, narrowing the blood vessels to quickly reduce swelling and take the heat out of the blemish. After icing, you can apply a targeted spot treatment. We recommend a 2.5% benzoyl peroxide. It's a common myth that higher concentrations are better, but they often just cause more irritation. This lower strength is just as effective at killing acne-causing bacteria. You only need the tiniest amount, the size of a single grain of rice. Apply it directly onto the blemish itself, avoiding the surrounding skin to prevent unnecessary dryness. For your daily AM routine, think of it as creating a shield for your skin. Start with a gentle cleanser, massaging it in for at least 45 seconds. In breakout-prone zones, you can apply a microdose of that same benzoyl peroxide as a preventative measure. Follow with a lightweight gel moisturizer to hydrate without clogging pores, and finish with the most crucial step, SPF 50. To ensure you're using enough, follow the 2-finger rule. Dispense a line of sunscreen down your index and middle fingers and apply that amount to your face and neck. Sunscreen is non-negotiable, especially when using exfoliating acids or retinoids, as it prevents sun damage and stops acne marks from darkening. In the evening, if you've worn makeup or sunscreen, a double cleanse is essential. Begin with a cleansing balm or oil on dry skin. Massage for 30 seconds, allowing it to dissolve everything. Then, emulsify with water and rinse. Follow with your gel cleanser for 45 seconds to ensure your skin is perfectly clean. Your PM treatment routine should be about rotation to protect your skin barrier. Never use your strong actives on the same night. On night 1, use your salicylic acid, focusing on the T-zone. On night 2, use a pea-sized amount of your retinoid for the entire face. Retinoids are powerful, so a little goes a long way. Then, for nights 3 and 4, give your skin a rest. These are recovery nights. Focus only on cleansing and applying a nourishing moisturizer. This cycle allows your skin to reap the benefits of the actives without becoming irritated or compromised. This is how you build strong, clear, resilient skin. Hands off. Fresh pillowcases, rinse sweat ASAP, clean phone screen. Simple beats aggressive. Gentle technique, clearer pores, calmer skin. For more evidence-based, no-fluff skincare, subscribe.